on here? Hang on. Oh. Hang on. Oh, shoot. Oh, there you are.
I'm here.
What the heck? That was weird. Okay. I don't know. I was like, gosh, you're still on my screen, but did it say you have good signal on the top? Do you have a signal?
Yeah, so it's excellent.
Okay, so does mine. All right, wonderful.
Okay.
Well,
yeah, and it's counted down like a minute something, so we're good.
Okay, good. I was like, wait a second. Where did she go? All right, great. We got this. Okay, now I can start. We'll just have chop off the first 2 minutes here.
Yes, I hope so.
Yeah, texting.
That's funny.
All right. Well, thank you guys so much for joining us on our Women's Health series. I've got Stephanie Terrell over here with me. And as we've gone through these and we are talking about ways to live a healthier life, have a better and higher life experience, a lot of the people that we're talking to are wonderful and amazing guides and have done a ton of research and background in helping us do that. Because we can't know everything, of course. There's so many things we can worry about or not worry about. Sometimes we overcomplicate our lives, and other times we just don't even realize that there's simple things we can do that can definitely elevate our experience in this world. And we know as women, our health and our hormones really matter. And it's kind of been the theme throughout May. And I've got some exciting news for you guys with Stephanie and a special she's got for you guys in May, which is really going to be super beneficial for all of you. And as you know, we're talking about breast therms. We're talking about hormones. We are talking about simply women's health. And Stephanie's got a great background in all of this. She is a family nurse practitioner. However, she's done all things women. That's kind of just been your love, right?
Yeah. Yes.
Of women. And now that she's on her own, she can really do a lot of what her heart's been desiring, and having a voice there that's not drowned out, that's, been more of pro natural approach to health rather than very all Western, because you have a Western background, obviously, right?
I do. And it takes a lot to learn the non-Western side of it. And it's been a lot on my own and finding those resources. But yeah, I really enjoy trying to always add it in.
I'm so glad you did.
Yes.
I'm so glad you did. So a lot of what had drawn me to Stephanie was the breast therms, but she does all sorts of amazing things and helping with, going to herbs rather than medicine, and a lot of things that women that watch this series are into. Quite a few of them would prefer to help their body heal on its own. So I would love to just have you start chatting about how you found breast therms and some of the benefits to it.
Yeah.
And what you're looking for.
Yeah. So probably came to my knowledge about 2010, 2011, when patients were starting to tell me they didn't want to have a mammogram, or they had to keep going back in for more and more imaging, and they were just done and they said they weren't going to get a mammogram. So I'm like, well, what's better screening for my patients that they will do? And so I was introduced to breast thermography by another provider in the area. And then I was already looking at going out on my own in 2012. So I did a lot of research on trying to get certified for thermography and getting an infrared camera to start doing the thermography. So in 2013, when I opened my practice, I had my thermogram and was ready to go. So the reason I like thermography, though, is basically, number one is no radiation to the breast. It's just 5 images off a camera. So we don't even touch the breast. Second of all, just earlier screening for women, so it can be any age. We don't have to wait for the magical age of, whatever they decide, 40 or 50 or whatever. So 20 is the baseline, 20 to 30, they say you could go every 3 years, and then over 40 or even over 30, they say you can go every year with thermography. And then, so those are the top 2 reasons. And then just really looking for early signs of changes in their breast health can really help with prevention. So that's kind of why I gear towards breast thermography.
Me too. Yeah. So I'm gonna. Am I in the background or not?
Yeah, you're good. Yeah.
Okay. So I'm just going to be a little bit dramatic about what my experience of it, because I know Stephanie's not going to talk super negative about mammograms, but my experience was when I started school, when we were getting our doctorate, and the professor was talking about the damage that happens during mammogram. And this was new to me because mammogram is so, save breast cancer. We got the pink ribbon. We're trying to save lives here. We got this wonderful thing called a mammogram, early detection. And what they aren't telling you is the negative effects of it. And, we're talking very positive of let's catch cancer early. And instead, when she's talking about smashing down the breast tissue, somebody that's had a mammogram knows about it, and radiating it with over 1,000 times the radiation we would get as a chest x-ray to damage tissue. And typically there's a second follow-up if they find something that's going on. And then we're followed up by a ultrasound, which is cheaper and non-invasive. So I then had the same experience with my mom and got to go in with her on her, false positive follow-up mammogram and saw how dramatic it appeared and thought, oh, wow, this is really true. And then getting into practice, hearing the same story over and over again, even to the fact of, a ton of emotional trauma with now we've found a spot we want to take out. We found some tissue, there's a lump, let's remove it and test it for cancer. And many times it's been negative. It's a benign cyst. We have a fibrosis in our breasts. And women go through this trauma over and over again. Now they're high risk. Now we've had damage to the tissue. So logically, when you're looking at a breast and metabolism to the breast, and even talking to you, Stephanie, about the estrogen to the breast, it makes sense to do a thermography rather than traumatize the women. And how early you're talking with detection. Can you talk to them about those scans, what you're looking for?
So early on, you'll start to see estrogen kind of keep the vessels open, feeding the blood flow to the breast. And so we all do that. That's a great thing, especially lactation and other times in our life. But when you go unprotected or unbalanced with your estrogen, especially as we get older, that starts to keep those pathways open too, like you said, feed abnormal cells or feed areas that are been traumatized. And then you start that whole process. And then it just, leads to higher risk of obtaining a breast cancer just by all those things combined, estrogen unexposed or unbalanced, and then just feeding already breast tissue that is very adaptable to having atypical cells. And so we just really start to look for that pattern very early on instead of radiating and causing all the issues that we're trying to prevent too, with trauma, radiation, exposures, outside exposures, unbalanced hormones, that kind of stuff.
And a lot of I was going to say a lot of what we talk about is balance with hormones in women. That's an easy thing to get thrown off. And then one of the things you had mentioned earlier, having 160 exogenous estrogen factors in our lives.
Yeah. And so we don't even know the realm of it. So if you can find it earlier screening that you're looking for those small changes in their blood flow or their vascular changes, you're going to have a lot sooner, idea of how you can help them find better prevention, better breast health, and say, let's change this now before you start to see the actual cells, abnormal cells, like a growth in a mammogram. And, their breast thermography is about 90% sensitive to, a cancer looking. We look at that because why do a test if it's not very accurate or sensitive to it? And mammograms are about 80% when trying to find abnormal growth or cells. But when you combine them or combine screening techniques, you get about a 95% sensitivity looking for any abnormalities.
That's amazing. Really mentioned, like we're talking about looking at the structure of the breast, knowing having a baseline. That's really refreshing to say we can really prevent this ahead of time because there's things like you mentioned that women are doing to balance their hormones in your family as well.
Right. Just talking about, ways to reduce what we can and ways to balance the hormones and showing the difference. So a patient of mine changed her diet drastically and added more flaxseed, which is a kind of a phytoestrogen. It acts just like an estrogen. And I could tell in 2 years' time from when she did her first thermogram to the next one, such a difference in her blood vessels being more open, more speckling, just looking more at risk. And her thermogram changed in its rating. And I said, what did you change? And we kind of talked about it, and I brought up flaxseed. And she's like, I just started adding more flaxseed in. And we all know that's supposed to be healthy. But again, it's an estrogen and it can feed blood flow to the tissue. So if we're really trying to reduce your risk and your high risk, that might be something we talk about. So with her, I just said, let's try to look at reducing that because it has made a change on your breast health.
That is just wild. Yeah. I do remember that they have men of oil for prostate.
Yeah. So. Yeah, and soy, that is where kind of the kick is. And I'll never tell a patient not to be healthy and eat soy and flaxseed, but there's other ways too. It just depends on how their thermogram comes out and what their risk factors are. And if they're trying to really reduce every risk factor to keep their breast health, the best. So it's just all, you have to figure out where they're at and where their rating is at too, and how it's affecting.
One thing in my mind, we hadn't talked about it yet, but how useful is this for women with breast augmentation or even breast reduction surgery?
Right. So the benefit is that we're not looking for anything. We're not going through structure. So we're just looking at blood patterns and hot, cold, and you see that, and heat. So you're bypassing all the structural stuff that will get in your way to find those little small growths too. So yeah, there's plenty of women who, again, don't want mammograms because of augmentation or dense tissue. And they're like the prime patient to have come do thermography too. Especially the fibrocystic ones. They're the ones that keep having to go back in for additional testing. And they're the ones that get frustrated because they know it's just their dense tissue skewing the mammogram. Mm-hmm. But ultrasounds can be good in that realm, and so can MRIs to kind of, keep in conjunction with the thermograms that we're getting best screening for them.
Do they do mammograms on augmented breast?
They do, and there's plenty of patients that have had mammograms and do. Some will put it off a little bit later, like the new guidelines 50 to start mammograms for some of those patients, and so maybe we'll just do a baseline a little bit later, we'll talk about it too, but there's some that still do their mammograms pretty routinely with the implant.
They do. It's an interesting theme that has come to the surface more recently, and maybe it's even been, before, but I have way more patients taking out their breast augmentation.
Mm-hmm. Oh yeah. I've had that too, and where they wanted to see what their thermogram looked prior to and after, or that they really felt like they had a lot of issues based on that. So I get that question a lot.
Are you seeing a lot of variation with the breast augmentation?
I don't really see a lot of variations per se. Maybe one, like I felt like her breast blood vessels were more pronounced, and I think she still came back at a pretty average rating. But I don't feel like they changed that too much on the visual vascular change of it too. I haven't seen one that maybe that it's become so inflammatory from those, product in their body. But I also don't do the full body scans very often, and you might see more that way too.
Okay. Yeah, because I know it's usually the inflammation that they're kind of worried about.
Yeah. But no, I haven't really seen that per se, just right off the top of my head.
Okay.
But again, yeah.
Well, that'll be helpful for them to know as well, I would think, especially in and out.
And following it more, sometimes I think patients, maybe the reason why I haven't seen that is over time, their patients, I'm the same way, maybe aren't as consistent, even with thermograms, just like they'd be with mammograms. So we don't see that over time, how they develop or their pattern or their screening. They may go miss a year. And so you're not seeing that over time, maybe that you would have seen with someone else.
Right.
If that makes sense. So just doing it more often might help.
And knowing that starting at 20 is a good baseline, that's really great to know. So I need to get my breast thermography done. I'll be 40 this year.
Yeah. Instead of doing your baseline mammogram, right?
I don't want that. I have especially fibrosis, the breast tissue.
Definitely. We all do. And that's why they delayed mammograms till 50, is they were trying to get out of that and excessive testing, but it really hasn't changed that.
No, it unfortunately hasn't. So we appreciate
they came up with more imaging options like 3D, so more exposure. So they were trying to fix that problem of like dense tissue. So they wanted better imaging. So they added 3D mammograms, which is actually more radiation too, on top of what we were already trying to get away from. So.
Oh my goodness.
Yeah.
That's terrifying. And one of the things that you kind of surprised me by, or I just hadn't really thought about it, is all of the plastics that are affecting as well.
Yeah. Well, yeah. And we can go to such an extreme of that. But I think just like you said, if we get your baseline thermogram and we know you're really got some changes and you're in that T3 rating, that's kind of like, hey, you could have better breast health. That's when then we start looking at like, well, what can we do to help that? Is it balancing better hormone and not being so estrogen dominant? Or is it taking out some products that maybe you are on that side of not really being aware of? And I would say I'm probably on that side of using like plastics and things like that, and needing to be more on the other side because I'm at that really great age of estrogen, dominance, imbalance, and then adding all those extra things in. Breast health's not great. So breast pain, those are ways that you can start to say, yeah, your breast health's not ideal. We can do better.
Yes. And so people are listening and wondering, okay, do I just come here for a breast therm? But you've got lots of things. So tell them all of the things that you offer. I mean, they can get their pap smear there.
Yeah. So since I'm since I'm a nurse practitioner and I take insurances, I usually try to bill as much as I'm able to out, inside their insurance coverage. So doing annual exams every year is important. Even if I'm not doing the pap every year, that's a great time to connect and just kind of talk about prevention, and then making sure there are medications, but then hormones. That's probably number one talk. And just really, again, trying to treat their symptoms as they go through perimenopause, which is like more than 12 years, I feel like. So, just really talking about that. But gynecology, just family practice stuff. So I'll try to be their primary if I can, if they're doing well and they want me to manage some of their other things like blood pressure, stuff like that too, if they're stable and I feel like they don't need to see someone else.
That's
urgent care stuff, if I can squeeze patients in, definitely UTIs, the urgent needs too.
Blood draws.
Yep, definitely have a great MA that is fabulous at blood draws. So. Yeah. I can vouch for that because I don't like it myself. So she's great.
Oh, that's so wonderful.
Yeah.
And you're near our office. You're near Chiropractic, just off of Hill Road, kind of hidden, but a cute little place, a little nook back there.
I really love our location. It's great. Quiet.
So convenient. Yes. Kind of near Gerber Park. So she's right in Eagle, which is fantastic. You can give her office a call. We're going to put your website on there.
Great.
And
they can book from the website. They can book from the website, even thermograms. And so in May, I'm trying to set up more days just to get those patients in for Breast Screening Awareness Month and stuff like that.
So like you mentioned, it's approved by the FDA. However, not very many insurances are going to reimburse for it, or basically none.
Yeah.
So we're special rather than $195 in May for we're doing women's wellness. So are you?
Yep. Yes. And I always honor that, and especially in October when the other month is that we do breast screening awareness. And then usually if a patient's been a patient and had a thermogram, I'll kind of keep that pricing for them, just so we can get them in and keep them consistent with doing their thermograms, because I know it's a cost out of their pocket too.
What a great time to start.
Yeah.
This is awesome. Okay.
Thank you. Yeah.
Yes, I appreciate you being here. I appreciate you doing this for women and being a great voice for natural alternative medicine. And what a great alternative for women to be able to have.
Yeah, I definitely think so.
Non-invasive, all the things that we talk about. So thank you so much for your time.
Yeah, thank you.
And we will be chatting with you always and very soon.
Yes, thank you. Have a great day.
Stephanie.
Thank you.